The next question I have for you came from Dr. Graham Stokes. He's a geropsychiatrist from England whom I met a couple of years ago over in the UK. And he asked his audience one day, who's in worse shape? A person with dementia who's always resisting, pacing, striking out, calling out, or a person with dementia who is always quiet and disengaged and lets staff do everything for them? And once again, you know, if you work in an environment where you are taught to focus on tasks, and I have so many people to get out of bed, or I have so many pills to pass, and this is my priority, the first guy, the one who's kind of resistive and loud and doing things, is the problem, because that person keeps you from completing your list of tasks that you have to come up with. And so we see that person as a problem, and we tend to attend to that person, especially with sedating medications. But Dr. Stokes said, you know, if you look at medical studies, they show that people who are pacing, people who are physically active, actually have many indices of better, more robust health than people who are more withdrawn. And actually the second person, the one that's got that sort of prisoner of war withdrawal type of response, is the one we should really be worrying about, because they're the ones that have disengaged, they can no longer succeed in our environment, and they're the ones that are more likely to get complications. And I think that's why you see some of that increased mortality in people on these medications, because the danger of a sedating drug is you can turn the first guy into the second one by using that medication. And Dr. Cohen-Mansfield, talking about the same issue, says that when a person is aggressive or calling out or agitated or pacing, they're communicating a need. And you may or may not like the way they're trying to communicate, but this is what they're doing. And if you give a sedating medication to that person, you may be taking away the only avenue they have to let you know there's something wrong. And that doesn't really help you to better care for that person.